of Health. It has a regularly scheduled meeting pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, General Laws, Chapter 30A, Section 18, and the Governor's March 15, 2020 order imposing strict limitation on the number of people that may gather in one place. This meeting of the Westborough Board of Health will be conducted by a remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and/or parties with a right and/or requirement to attend this meeting can be found on the Town of Westborough's website at town.westborough.ma.us. For this meeting, members of the public wishing to watch the meeting may do so in the following manner. I believe it's being streamed on westboroughTV.org. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite our best efforts, we will post on the Town of Westborough's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting. So we have a few items on our agenda today. And then I think we're going to flow directly into a joint meeting with the Board of Selectmen at 6:30. The first item on the agenda is... Yep.
Dr. Walsh, I just one of the things before we start the meeting, just one thing, the CDC just released, I think, a paper saying that 9,000 health workers have been infected by the COVID-19 disease and 27 have died. So I didn't know if we wanted to just take a moment of silence before we started this meeting to acknowledge all the people at the front lines of this epidemic.
Sure, you want to make a statement or you just want a moment of silence?
I was just going to say maybe we could just have a moment of silence to acknowledge all those people, and not just healthcare workers, but grocery workers, meat packers. They've all, I can't believe it's been a month since our last meeting and the whole world has changed. And so I just wanted to take a moment to acknowledge all those people that have suffered during this time.
Yeah, so I think it's important that we, acknowledge the fact that this is serious and that it's still ongoing and that we are, trying to stay on top of it. I think that we're going to try to deal with, I think, more of the coronavirus related issues maybe at the end, and we'll get through some of the more routine aspects of the Board of Health first, if that seems appropriate.
Yeah, that's fine.
So we've got the minutes from several meetings that we'd like to, approve. If there are no objections, we could do them all in one bunch. But if there are specific items that people want to address, we can take them individually.
There was one typographical correction needed. It is to the minutes of the March 12th meeting. And Paula, do you have that in front of you?
Yes, I do.
If you look at the next to last paragraph, Chairman Walsh reviewed the number of cased. That should be cases. First sentence in the next to last paragraph, March 12th.
Where was it? I'm sorry.
So the March 12th,
Yep.
the next to last paragraph on the first page.
Oh, okay. Yep.
Sorry.
Okay.
Chairman Walsh reviewed number of cased. It should be cases.
Right.
Okay. I didn't have any other comments about any of the minutes other than that one.
Okay. So then, go ahead, Syed.
So Paula, I know tomorrow is Administrative Professionals Day, so thank you for all of the work that you've been doing. And I just had just a couple of small comments. My comments referred, the first one I have is on the minutes of March 31st, 2020. In the paragraph where it says current number of COVID-19 in the state, okay? There was a request for data by precinct. You can just put in there that I requested that data, but I didn't think that the board agreed that it was inappropriate to do so. I thought we would keep an eye on that. I thought the discussion was that as the numbers would increase, we would consider adding that, that was my impression.
Syed, I mean, it was not that the board felt it was inappropriate. It was just inappropriate at that moment in time, not in principle.
Okay, so is that okay if we revise that to reflect that?
Yeah. I'm sorry. What page are you on?
It's the March 31st minute.
Yes.
And the current number of, there's that paragraph.
Which page of the minutes are we talking about?
Page one. Sorry, page one. Sorry.
Can I just say something?
Sure.
Yes.
So you're saying that the sentence that starts with Chairman Walsh noted that the Mass Department of Public Health has encouraged towns to not release
No, sorry.
Location?
It's March 31st. It's Director Bakari addressed a number of cases in town.
Yeah.
That paragraph. Okay.
That's what I'm reading. And as you go down, it said the Mass Department of Public Health has encouraged towns to not release the locations of those who are positive as it violates the Health Information Privacy Act.
Thank you, Paula. Okay, my bad.
Right.
Thank you.
No, I think my recollection was that I think that Syed did ask for a breakdown by, either precinct or some smaller division. And I do believe that we decided that we didn't want to do that at that point in time, and that we might revisit it. So if that's not captured in there, maybe we can just have an extra statement just describing that.
It's in the next sentence. After the HIPAA thing, the level of information the town is releasing is appropriate. There was a request for data by precinct.
Oh, okay, that is there.
The board agreed that it would be inappropriate to do so.
At that time, or is it what's missing, Paula?
Okay, at that time?
Perfect.
Yeah.
Yeah, that's probably correct. That's much better. Thank you, Paula, and thank you, everyone.
Okay.
And then on the April 7th, sorry, am I missing something?
No, I think you were going on to April 7th.
Yeah, so on April 7th, page 3, there's the second sentence from the top. Concerns regarding evictions, foreclosures, and lodging was mentioned. Do you just want to put, since I'm the guy that mentioned it, if you want to put my name, that'd be fine.
Okay.
Because I had concerns
Okay.
about those. Okay.
Will do.
Thank you, Paula.
Okay.
And if you were in the office, we'd get you some cake or something, but this will have to do.
No, it's all right. I have chocolate chip cookies.
We'll still give you a rain check since it's raining today.
Okay.
I move we accept the minutes of March 10th, 12th, 31st. Did I miss one?
Nope.
Sorry. 31st and April 7th as amended.
I second that motion.
We're going to do it by roll call vote to approve things during this meeting. So Dr. Walsh is a yes. Dr. Ehrlich?
Yes.
Dr. Hashmi?
Yes, I'm just curious. Does the Board of Selectmen have to approve these minutes, or is it our meeting? Therefore, we approve.
This is our meeting.
Okay. All right.
They can approve them at their meeting because they were part of it and they did have votes in them. So they will review them and approve them at their meeting.
Okay.
Yeah, and if there's any sort of combined edits that we want to do, we can then, approve those changes that they make. So next on the agenda, the director's report. We kind of have 2 months, February and March, for most of these next issues.
I had no questions on the director's reports.
Neither did I. Just to thank Steve. I know it was a busy couple of months for him. Thank you.
No, I thought the reports were done well as well. So I had no issues there. So do we have a motion then for the February and March director's report? Or Steve, do you have anything you want to add on the director's report, or are you comfortable with that?
No, I'm all set.
Good.
I move we accept the director's reports for February and March 2020 as presented.
I second them.
Okay, we're going to do it by roll call vote. Dr. Hashmi?
Yes.
Dr. Ehrlich?
Yes.
Dr. Walsh? Yes. Good. So we can move on to the sanitarians report for February and March.
So does anyone want to comment on, we asked questions about Mandarin, Mayuri, and Paradise Biryani Point, or is Mandarin taken care of?
No, I think these should be brought up. So why don't we take them individually, though, as opposed to as a group? Which one do you want to start with, Syed?
Whichever one is best for whichever one. I'm
So Ray, you want to pick one of those?
Okay, so let's start with Paradise Biani Point. They did get their second re-inspection, and everything was taken care of except for one small item, which wasn't a huge deal. And so they're back up into compliance. But recently, while I was out last week on a day that Erin was covering the office, she did have a complaint that she had to go in on, but she can talk about that after, because right now we're just dealing with the individuals. But Erin did have an issue with a complaint there about possible foodborne illness complaint.
Okay.
And is there new management? Correct me if I'm wrong. I'm sorry. There's been just so much. Is there new management, Ray?
Yes, about 6 to 9 months ago, if I'm correct, right, Erin?
Yeah, that sounds about right.
Okay.
But they're still under. Are they still under probation?
No probation there. Where they're looking to drop on if they continue in the way they've been.
Okay. All right. Thank you.
All right. What was the next one you wanted information on?
Mayuri?
Mayuri. That one wasn't one of mine. I believe that was one of Erin's.
Okay.
I don't
We
have my
can talk
paperwork
about-
in front.
No. Okay. And Mandarin? Do we have to be worried about Mandarin, or is that okay?
Mandarin seemed to do okay. They did have an inspection. They had a few issues. I was at the beginning of the whole COVID issue. They were short staffed because they had 19 people who were quarantined. 6 were in New York at the airport. So they lost the sushi chef for about 4 weeks. But David was there. David, I believe. Yeah, David was there. He's not really the manager, but he's the one who speaks English. So he was there and handled everything with me, and I was happy with the way he answered everything.
Okay, thank you.
Ray, it does look like you did Mayuri in February, but
February.
It doesn't look like it was too bad. 1 priority, 1 priority foundation, and 5 core.
All right, that's why I didn't remember, because they actually did very well.
Yeah.
That's the thing. If they don't stand out, that means they did okay.
Yeah. Let's see. I had a note here. There's something called WHA. I think that was in the
Westborough Housing Authority.
Yeah. So
21 floors.
Yes, I didn't actually understand what was going on there in the description.
I got called in, or Steve got called in. I covered it. The Westborough Housing Authority asked us to come in and do an inspection. I guess they were going through some proceedings with the tenant. It's been going on for a couple of years. And Steve can correct me if I'm wrong, but I went out there with the fire department and the Westborough Housing Authority and went out and wrote a report. There were some issues on both sides. She's kind of a hoarder, semi-hoarder. There was egress violations. There was some issues with, I couldn't find it while I was there. There was some issues with water intrusion, but every time it rains, we ask her to call us to show us the water intrusion. She never does. And then a month after it rained, she says, well, I had 2 inches in here, but so we can't prove anything. I'm not finding any damage that would be water related. So that one is just, there was a notification just to let everybody know what's going on in that case. Steve can actually probably step in and talk a little more about that.
Sure. There's due rent too. So there's different things going back and forth between, the housing authority and the tenant. And the housing authority just wanted us in there to kind of make sure that everything was where it needed to be. Because I don't know if they're going to pursue, court action against, the tenant or not. So they asked us to go in there.
Okay, good. I think that was all I had then on the sanitarians reports.
Sorry, it's I just had a couple of more questions, if you don't mind. Sorry, I forgot. What about this Concom thing about a sewer line backup? Do we know what was, has that been, I guess I know it was fixed, but do we know what the cause of that was?
You talked about the one on East Main Street?
Yeah, the 54, yeah.
Yeah, they found out that attached to, I can't remember the name of the street, but where the Dunkin' Donuts and the Rocco's Donuts is down there at the healthcare facility. They had a broken unit, and it wasn't they have what you call a it's like a muff. They call it a muffin binder or something, and it chops everything up. Well, it had been broken, and the healthcare center didn't fix it, so everything was going through without getting chopped up or separated. So they found gloves, adult diapers, stuff like that in the sewer thing. So that's where it came from.
And who was it? So the healthcare facility was responsible for the maintenance of that?
Yeah, the sewer department was going to handle that. We just went in to make sure the restaurant didn't get affected. But once we figured out they were all set, the sewer department is following up on everything else.
Okay, all right. And then the other question I had, Ray, was what was this business about the 3 cesspools were found at Fales? Could you explain what that means?
Well, whenever they're going to attach to sewer, they have to get rid of cesspools. So when they're doing the groundwork out there now, and they found that these cesspools were there. I don't believe they were in use. I think Fales was back on sewer, but back in the day when they transferred over, they never destroyed them. So I got called out.
Those weren't there. Okay.
Yeah, and I was actually out there again today because the septic tank was crushed today. They tore down the septic tank today. So they thought there was only one. They found the plans, and there was only 2 on the plans, and they found a 3rd. So they took care of all those when I was there the first time. And then today they called me this morning at 7:30, asked me to go out today. I went out today, and I witnessed them crush in the tank.
Okay, so now the new school is going to be hooked up to sewer, right? Yes?
Well, the old school is hooked up to sewer too. It's just they never, back when they did it, they never called anybody to have it surveyed or whatever, so it crushed in or witnessed. But now it's so it's all set.
So Syed, back when that school was connected to sewer, there probably was no regulation to crush in the old systems. That regulation went into effect in 95 or so, and that school was connected way before that. So this is stuff that has probably sat there for decades.
Okay, no, thanks, Steve. I just thank you.
I have a quick question for Ray. Under Crunch Fitness, it says basically routine inspection conducted. They must label chemical bottles and clean dust from the back of the unit. What unit are you talking about?
That's under the tanning. So it's the tanning unit. So it should be under the heading tanning salons or tanning.
I see. I think that's on the previous page, which is probably why. Yes. So the tanning header is on the previous page.
Okay.
Got it. All right. Thank you.
No problem.
I move we accept the sanitarians reports for February and March 2020.
I second.
Okay, we'll do this by roll call vote. Dr. Ehrlich?
Yes.
Dr. Hackney?
Yes.
Dr. Walsh? Yes. Let's see. Next on the agenda is the health inspectors reports for February and March.
Hey, can I commend our health inspector who apparently got a Master of Science degree without telling us? What's up with that? What's going on? Congratulations.
It's been long coming.
Oh, well
yes, I
done.
wanted to congratulate you. I wanted you to know, maybe you knew this already, but biostatistics is near and dear to my heart. I hope you did well in that.
There was a few times I almost called you for help.
Well done, Aaron. Congratulations. Well done.
Thank you.
Yes. I had a question about Irani, which has not been doing so well. March 1, maybe?
Durrani, yes. So they still have their, well, not right now, but they were still having their food safety consultant come in once a week. Ray and I actually both went out there and met directly with him to do an inspection kind of together. And we're definitely finding different things than they are. They're definitely doing better. So I think they actually just recently reopened. They were closed for a few weeks, and I believe they just reopened this week. So I'll make a point on going out there again next week to make sure they're on track.
How has the workload been for you and Ray in terms of getting to places and having this whole thing work?
It's all right. It's manageable. I'm able to go, I have my kids at home right now too, so I'm kind of able to on my days from home, I'm able to pop out to different restaurants a few times a day, and I address most of the complaints. So any of the food related complaints in town. So I'm doing a lot of that, and it's fairly manageable right now.
Okay. How about you, Ray?
Well, I'm in the office 2 days a week normally. Come in tomorrow. Tomorrow I'm in. Thursday I'll be going in to work on the transfer station. It's more difficult for me to come in from Auburn for a 25-minute ride to do one restaurant and then drive home. So I try and figure out what I can do on one day. So I really haven't touched a lot of restaurants. I've been dealing a lot more with complaints. I've had this month's list is a little stronger with complaints. We had some COVID complaints about different places being open and everything like that. So been working on that, doing a lot more. I'm still working on plans here. I got a couple. Cumberland Farms is doing a remodel. We got a few other places that are doing some work. So I'm keeping myself busy with that stuff as well. But it's a little more difficult for me to run out and do restaurants. If I lived closer, I could go out, do a restaurant, go home, go out, do a restaurant. I'm not saying it's easy for Erin, but living in town kind of gives it a little bit better advantage to get in and get some of these restaurants done. Because as she knows, you drive out thinking they're open and then they're not open. And if you call ahead of time, then you're warning them. So it's kind of difficult.
Yeah, one of the reasons I asked is that in this situation that we're in right now, I wonder if we need to, be more willing to just close a restaurant that is having problems rather than our, process of, having them be on probation for 6 months and, letting things go on for a very long period of time. If restaurants is already having a problem and we notice that it continues to have a problem, we may want this process to go a little bit faster than it has in the past.
So, Nathan, I've actually been spending a lot more time in each restaurant. A lot of them are closed now, so my list is smaller, but I've been spending probably 2 to 3 times the amount of time in each place because I'm not leaving until I'm, happy and convinced that they're going to be safe and have safe practices. So, if a restaurant typically takes me, 45 minutes to do, I'm staying there for almost 2 hours and just, walking through every step to make sure that they're keeping everyone safe. So I've been definitely working with them more. There was one, I was recently at Sapporo and they definitely had a lot of concerns. So I stayed there a long time. And then I ended up coming back a few days later just to make sure I was comfortable with that. And so far, that's working out pretty well.
So there's obviously logistical things for restaurants that aren't used to doing the volume of takeout that they would usually do, and they're trying to adapt to that, that's where we're finding a little bit of problems. I think that's where Erin was finding problems. Your places with drive-throughs probably aren't having any problem at all, but your places that normally have sit down and now they've adapted to doing takeout, they may not have all their ducks in a row as far as how to do it properly or to do the volume that they're doing. So that's the concern.
No, I think giving the restaurants the time to, and the instruction on how to do it right is going to be very useful. So I applaud you guys for doing that. But if you notice that somebody is doing something wrong and you need us to take action or you want to take action on your own, you have to use your judgment. I think that where we are meeting fairly often, it should be pretty quick for us to get a response back if you want to run it by the board first. But I wouldn't want you to be noticing unsafe behaviors, especially at a time where we're worried about COVID-19. It might just be better to shut a place down than it is to let poor behaviors continue.
Right.
I don't know if Syed, you or Alan have any other comments on that front, but.
Yeah, I'd like to work with the restaurants because, these are small businesses that are already struggling to survive. So, I don't mind having we're meeting weekly. I don't mind having a discussion unless it's something egregious. I think and again, Ray, Aaron, and Steve, I think most of the people that worked with us they're working with us, right? I mean, yesterday I know Aaron went out and was able to really help a restaurant, and I just, I think that was a good thing. I mean, I think that if we can help these restaurants survive this, and and can convince our residents that that they're safe, I think that's a good thing.
I'm inclined towards what Syed is saying. What I would say is, really, I think the COVID-19 aspect is not what I worry about in this, and so it's more, I think, along the lines of what was said about restaurants that have not done a large volume of takeout and now are doing so. So as long as that aspect isn't being compromised, then I think we just continue doing things as we usually would. Again, obviously the appropriate social distancing with pickups or deliveries and things like that. But again, I also agree with Nathan saying we meet weekly. So if there are any issues, it doesn't take that long to get us together to help sort things out.
Yeah, and please speak up at meetings. Jump in if there's something that you think should be brought up and it's either not on the agenda or I'm just kind of running through to try to fit everything in. It is important that you guys speak up.
Yeah, and so far all the restaurants have been very willing to do what we're asking. So they've all been willing to adapt and adjust their practices.
Awesome.
Yep.
It's good to hear.
And I have no problem speaking up, so.
Yeah, Ray, we know that, okay? We're talking to Aaron, okay?
So if there are no other issues,
well, just for me, just one other thing real quick. What about Chengdu?
Chengdu. Sorry, I feel like this was a lifetime ago.
It was a lifetime ago, man. It was.
So Chengdu, oh yes, so I did go back for their reinspection and they had corrected all the violations. I actually got a phone call today, funny enough, from somebody who had a concern about a restaurant, but she was praising Chengdu, saying that she's gotten takeout there and they come out, with their masks and gloves, and actually they've been giving people masks, I guess, when they do takeout. So I thought that was interesting.
And Steve, just out of curiosity, is there like a best practices kind of paper or something that you're aware of for restaurants that is out there?
Yeah, Aaron put something together right at the beginning. It's actually on the website.
Wonderful. Great.
So
okay.
Under the Board of Health page, it's right there. So.
Okay, great. Good job.
Yep.
Well done. Thank you.
You want to make a motion, Syed?
Yeah, I'll make a motion. We accept the health inspector's report. Also make a motion that we acknowledge that our health inspector got a Master of Science degree and that we are and commend her for the effort.
I'll second that. Each of those.
For both the February and the March reports?
Yes.
Okay. Let's see, Dr. Ehrlich?
Yes.
Dr. Hashmi?
Yes.
Dr. Walsh? Yes. Then we can move on to director's issues.
Okay. So we did, I don't know if you saw this, Nathan, we do have something at 6:00, an agenda item.
Let me jump back to the agenda. Hold on. Yes, we do. So this is the discussion vote on appointing members to the Waste Management Committee.
Correct.
Why don't we go ahead then and do that first?
Yep.
Do I need to do anything to open up that point? Is this a...
Well, you want me to kind of summarize? It's been a little while. So at the last meeting, at last several meetings, we've had discussions about the town creating a waste reduction committee, and we have a proposal on. Excuse me. Throughout the last couple of months, we've put together a proposal on what the committee would be made up of. Sorry, as far as membership, and I don't know if you all have the write-up in front of you about who it would entail as far as membership, but briefly, it's myself, Dr. Ehrlich, Scott Kadish, who was one of the members on the previous Materials Management Committee years ago, and Katie Curtin-Mester, who is a member of Sustainable Westborough. But we have 4 open spots, which we put out the call to people as far as asking people, residents, if they're interested to let us know that. And we did get 5 people return the emails with a write-up of, why they were interested, that sort of thing. So I believe you all have those 5 emails. So we have 4 positions and 5 applicants. So I don't know if you've had time to look at them to kind of peruse to see who you might want, might not want, but that's what this is about.
Okay. We could do this voting in a number of ways. I don't know if Alan, you or Syed have a particular way to do it. If everyone wanted to give their top 2 people, we can see what the overlap is, and then we can kind of work down through our later choices after that. But I'm open to suggestions if people want.
I have a suggestion.
Yep.
We got 5 applicants. We got 4 positions. The committee, I think, could handle 5 people, and we should just take everybody who stepped up. I don't think, especially under these circumstances, we have a valid way of really sorting this out. We can't interview people. The only question I would have would be for Steve. I know some people identified themselves as either curbside people or transfer station people. It wasn't clear everybody did. I don't know if you have that data, what the breakdown is.
Yeah, I don't, unfortunately. But I mean, I agree with your proposal just to accept everybody. I mean, we can take one more. It's not the end of the world. So, I mean, this is what we got, and I think it makes sense to take them all. But yeah, I don't. If they didn't outright say it in their thing, then unfortunately, I don't have that.
I mean, I thought they all looked fine. I didn't see anybody where I thought there was a red flag of any sort. And so, I think we have 5 interested citizens instead of 4. Okay, we put 5 on the committee. If people, and since I will say Nathan and Syed, you 2 don't have to be on the committee, so the extra unwieldiness of one more person is more of a problem for me than for anybody else.
So then I make a motion that we update the makeup of the committee to include 5 members from the public.
I second that.
Okay. So Dr. Hashmi,
yes.
you vote on that? Dr. Ehrlich?
Yes.
Dr. Walsh, yes. So that I don't think we have to then do any more discussion. I think that all 5 of these are fine. I think we just need a vote on accepting all of 5 of these people for the positions. And Steve, if you could just do me the favor of reading off the names for the record.
Sure. So it's Nathan Askew, J.J. Malone, Sherry Ruff, Meg White, and Lauren. Bowerstadt.
Okay.
Sorry, I probably screwed that one up.
Good. So then does someone want to make a motion that we accept these 5 people?
I make that
move
motion.
Go ahead, Syed. Thank you. I'll second
I'll
it.
make that motion.
And I second.
Excellent. So Dr. Hashmi?
Yes. So will Steve be the one that'll be reaching out? Steve, will you circle back with these applicants?
Correct. I mean, I really think this would have to go on the back burner until we can.
Yeah, absolutely. That's the other thing I was going to say, that this can wait till
yeah,
after.
We can meet. I think, especially a first meeting, we need to be face to face. So
Agreed.
at least for now, this will be in the back burner. We will reach out to everyone, let them know that they're on the committee and that information will be forthcoming in the future.
Yep. Thank you. I agree.
Dr. Walsh, yes. Dr. Ehrlich?
Yes.
Okay. So we have, I think, 20 minutes or so before the Board of Selectmen are going to join us. I think at that time, I'd like to talk a little bit about the state of coronavirus and where we are. I just had a webinar with the State's Department of Public Health. They were talking about their...
Hold on, Nathan. Sorry.
Yeah.
Before we do that, shouldn't we discuss the director's report or director's issues?
Oh, actually, yes. I got myself. Let's go back to the director's report.
Of course. So not too many. So this will be quick. So I don't know if I told the board, but we had that mattress recycling grant at the transfer station. DEP has suspended that program amid COVID because I guess the company that was doing the recycling couldn't do it for one reason or another. So just to let you know, our mattresses now are no longer being recycled. They're going in with the regular trash. when the program resumes, obviously we'll start recycling them again.
So, Steve, are we going to be informing the residents? Do you know?
Well, I mean, the residents won't notice any difference. We're still taking them. It's just a matter of final disposal won't be, recycled. They'll be going in with the waste stream for now.
Okay.
So I guess I could let people know, but it's not. They're not going to see any effect on their end, directly.
But for anyone listening, they would actually now be aware. So.
Yep.
And the thing is, Steve, and maybe we put something on the website. Ideally, if someone isn't in a rush, they can hold on to their mattress until such time as we are recycling again. And that would be, obviously, we just had this whole committee to figure out how we can reduce our waste stream, and a mattress is non-trivial.
Yeah. Okay. I can put something on there about that if it's possible.
We've also had, I think, a couple of issues where, waste is accumulating near dumpsters, and I think occasionally that does include mattresses. So we have to find that nice balance between, encouraging people to hold on to them, but not like leaving them in their yard or something like that.
Yeah, point taken. So moving on, we do have a new fluorescent bulb shed at the dump. We had talked about this. We were going to have it's an old, container box now, which is much sturdier, much in better shape. So that's there now. If residents go down there, they'll see that. Budget wise, and this is something that the town is looking to cut some money, so they came to the different departments and asked them to look at areas where we could cut. One thing I did put out there, and I think I might have talked to at least 2 or 3 of you about this, is Hazardous Waste Day. We have gone years without Hazardous Waste Day in the past. Probably not since Nathan or Syed have been on, but I think Dr. Ehrlich, you might remember years past, we've had tough times and we've gone a year or 2 without having it. I did propose that. I don't know what the system is to, as far as whether it does get cut or not, but Hazardous Waste Day is expensive. It's $20,000 for 4 hours. Okay, so there are other ways for people to get rid of a lot of the stuff and things that we can't take year round. There is New England Disposal Technologies in Sutton that will take hazardous waste for a fee, but it's still a way to get rid of it. So that was one thing that I proposed to be cut this year because of budgetary reasons.
Steve, on that point, my recollection is we have skipped, but I don't think we've ever skipped 2 years in a row. Not that I recall. So if we do skip, I think it should be with an eye to the fact that we will be having it the following year.
I think you're right about that. And so mosquito control was the other thing we talked about. We are not cutting that. We're keeping that just because, for obvious reasons, we're worried about a resurgence in Triple E this year.
So we're not cutting that, right, Steve?
We're not cutting it, but I was going to propose more money, $1,000 more. I don't know if they're going to go for that, but we'll at least be level funded. I have talked to Central Mass Mosquito Control, which does do mosquito control activities in town. He said he could certainly help out with anything that we need as far as larviciding. So we do have them as a backup if needed. So I think we're in good shape there.
Okay. And Dr. Walsh, can regarding mosquito control, do you want me to wait till after Steve is done or discuss it now? What would you like?
No, jump in now. I think this is appropriate.
Okay, so Steve, thank you for keeping that, because we were critical Triple E last year. With everything that's happened, can you try to see if you can get him back in May? Because we were going to have a discussion with him, because one of the concerns was, because we were at high Triple E and despite the rain, it's been a relatively dry winter. I am really concerned about what this season will bring. So I was wondering if we could have potentially more traps. And the thing is, because I can't work out anymore, I have to walk everywhere, and we are just filled with swamps.
Yeah.
So go ahead.
I could certainly have Tim. Tim's willing to come on anytime. So I know we kind of pushed him off last minute just because of the whole coronavirus. Yeah. I will have him on next month.
Okay, thank you.
No, I think that sounds good. I think one of the things we should consider is, as we're learning from this coronavirus stuff, is the question of, are we testing enough? And so when it comes to the number of, pools of mosquitoes that we're testing and where we're, where we have those tests placed, it's probably good for us to reevaluate where they're placed and why they're placed there. some of it might just be historical, but it would be kind of nice if you could just address on where our traps are placed.
Yep, will do. Okay, and one last thing. So I don't know if you went on this, Nathan, today, but the state is going to start helping out local boards of health with their contact tracing for COVID. Starting May 1st, I think they'll have something like 800 people helping out the local health departments with doing contact tracing for cases. And, we still have control over whether we want that help or not. It just comes in the form of, when there's a case in the system, you would check a box if you wanted help. And if you didn't want to help, you would tell them you want to keep it. So this will be a great help to us if needed. Right now, I think we're doing just fine. The school nurses have stepped up. They are tremendous. But again, I'm always worried about where we're going from here as far as numbers, right? So this will be it's a great program that the state is launching, and it will give valuable data about when to pretty much start to open things up for the governor.
Steve,
go ahead.
Sorry, go ahead.
No, you go.
Okay, Steve. Yeah, I think this is obviously great, and we should participate to the extent that it helps us. And if the volume is not so great, no big deal. But if the numbers have been high in Westborough, we are one of the more affected cities or towns in the Commonwealth, at least on a per population basis. Even on an absolute basis, we have quite a large number. I was just going to ask you if you have a link for that program. I was on the phone earlier today with someone from a medical school who had some interest in having some of his third and fourth year students who are more limited in what they can do because of the whole coronavirus, potentially volunteering for that. And if you can just send me that link, I'd appreciate it.
We had I will. I'll send you the I'll have the contacts for who's running the program to you.
Great, that's all I need. Yep, thank you.
Yep.
Yeah, so I think on I think they were calling that program the CTC. I think it was the Community Tracing Collaborative. It's a program that is run by the Baker-Polito administration, and they've I think have Partners in Health is the one that's actually administering the program. But it sounds like a really good benefit to us, especially for those areas where we're having trouble. And it sounded like from prior conversations with you, Steve, that some of the congregate settings, especially like the nursing homes and that sort of thing, those were the ones that were hardest to try to follow up on every patient and figure out exactly what their status is. So maybe those would be the best cases to try using the CTC first.
Yeah, I've gotten better at that. I've spoken to the nurses at these facilities, and I think we're going to have better data coming forward. It just takes a little time to get organized, but we're getting there. So, but yes, I agree with you. I thought that when I was listening to the webcast that like those congregate care, long-term care facilities, they were going to kick those back to the locals because of we have a better knowledge of what's going on in town. I thought that's what they said, but
yeah, so my impression of what they said was that any cases that a local board of health wanted to keep because they thought they could do a better job, they wanted to make sure that the local boards of health kept those. And so they said, especially things like people that are homeless, where you might actually have to go out and like make a site visit, would be cases. They also thought that ones that are particularly high risk, they thought local boards of health might be, more inclined to want to kind of keep responsibility over all the tracking. And that would be something like the congregate settings that you're talking about. It depends on how good of a job we think we can do with reaching out to all of those people and figuring out the status of all of them. If it turned out that the nurses were hard to reach and it was hard to get through all the paperwork, having the CTC kind of do that would actually be beneficial. If you think you've figured it out and you don't need to hand it over to the CTC, that's fine. But I would say that hand more stuff off rather than less, because it's going to free you up to, kind of see the bigger picture.
Yep. Okay. Point taken. And that's about it for issues. A tremendous amount of time being spent on COVID, but we'll talk about that more.
And Steve, one quick question. There's the composting that's available, right? Is the marketing for that being done through Sustainable Westborough?
That was put out. Yeah. The marketing for that went out in a mailer that we sent out through. It was either maybe it was 2 water bills ago. It went out through one of the bills in town. And it was posted under town news. I'm sure it's got knocked off the front page since that was
Right.
like a week or two ago. I believe we have a link to it on our Board of Health page, but if anybody has any questions, they can certainly reach out to me, and I'll point them in the right direction.
No, residents had asked, and I know you have a lot on your plate. I wanted to kind of not burden you with this, so I was wondering if I could punt this off to Sustainable Westborough, or does it have to go through you?
It doesn't have to go through me. I just don't know who I don't know. Does Sustainable Westborough have a website or someone that, I mean, it's not that big a deal. I can get them the information fairly quick. So just have them, they can contact me, with an email.
Right.
I believe that it's not a town-run program, correct? It's a private group that's offering this, and they're working with, I think, individual people at first, and then there was talk of maybe having it operate through Harvey's, but it was still going to be a private group that was running it.
Correct. So the curbside collection, it's a private business in town. We're not vetting them or anything like that, but people would sign up with them, directly. We're not involved, and they'd get it picked up. But I certainly can provide the information about who's doing it. It's not a big deal.
All right. And Steve, one other thing. I know this is April, and when does the beach open? Or supposedly, when does it?
Generally, they open maybe the second week in June, and I think typically in the beginning it's weekends, and then when school gets out, they pretty much open full time. I don't want to talk too much, but I was talking to the rec director today. We had some discussion about.
Okay. So you started that discussion then?
Yeah,
okay.
Those discussions are happening right now, and the problem is we just don't know what's going to happen. Obviously, schools are closed now for rest of the year, and so, I mean, I guess we have to have the discussion, maybe with the selectmen too. Do we, if we're closing schools until the 26th or whatever it was, would we be having group gatherings on the beach after that? Do we want that? So all this stuff we do need to talk about. I don't know if we need to do it today, but
no, I think we could just put it on for our next meeting or something. And along those lines, because we're not potentially having the reason I bring this up is for two. One, because of the schools, and the other is because town meeting has been punted off now. The treatment that we were potentially going to do, the treatment and all of that, I suspect. I mean, the thing is, I'm just game playing here for a minute. If we're not going to be opening the beach, right? Then the urgency of doing the treatment lessens. Am I getting that correct?
Oh yeah, we've had I had talks about this with the rec department today, and we're going to be we have a kind of a meeting between me, the rec department, the Conservation Commission, and I think maybe Christie on Friday to kind of talk about some of this.
Okay, all right.
So it's in the works. It is being discussed behind the scenes right now, and we'll have more information.
Great, thank you.
One thing I wanted to talk about, and I don't know if you think it's more appropriate for the joint meeting with the Board of Selectmen, that's fine, but the issue of our local report on the status of COVID-19 in Westborough versus relying on the state town-by-town numbers. And I know we've gotten some communications from a resident about this. My feeling is, I think...
Do you want to wait for this till the Selectmen join us?
Well, my discussion is whether we want to talk amongst ourselves first. I mean, obviously, some people are still on the call. I don't mind that. But does the Board of Health have a position on this? Or we can obviously defer I think if we think it has value, then we should do it regardless of what the Board of Selectmen say. If we don't think it has value and the Board of Selectmen do, then we have a conversation with them. So I wanted to start just amongst ourselves to get a consensus, because my feeling is that it does have value. Perhaps the report can be modified in some way, but I think in a snapshot, being able to see what are the either week over week or whatever type of growth in cases there are, the change, that type of information, I think helps us as we assess what we're doing in a way that just seeing what's the total numbers coming from the state. Now, maybe the state numbers are broken down better, but when I was looking at the state website, all I saw was total numbers and cases per 1,000 or 100,000 or whatever it is. So that was my thought on the subject.
Well, the
Yeah,
thing was
I
initially.
think that's
Go ahead,
very
Dr. Walsh.
Dr. Ehrlich. I think that having this discussion as to what we want first, and then have a question as to what does the selectmen want later, I think makes sense. I'm a big believer in transparency. I think that I want to make sure that the numbers are getting out there. And I think that if the state wants to pick up releasing some of these numbers, I'm more than happy to have it done by them as well. In terms of how much extra do we gain by posting some of the other stuff in the report format, I want to balance that with how much work it takes for us to generate those numbers. And if it's taking a lot of work to generate those reports, then maybe we have to find out either easier ways of generating the reports or deciding whether it's actually worth making them.
I certainly agree with that. One of the things that differentiated our reports from the state reports were the inclusion of presumptive cases, although that hasn't seemed to have been a big component of it, and it's become even less so as testing becomes more widespread. But maybe, Steve, it's time for you to tell us how much work these things are and what value, if any, you see in them.
Well, it's a lot. It's been a lot of work the last 2 weeks, obviously, with the big explosion of cases, mainly from the long-term care facilities, right? So, and part of that is, these people that are in these long-term care facilities are probably not coming out, right? They're going to be there now. So they're always going to be hospitalized, right? But most of them will recover. So getting that data, obviously I'm working on that right now with the places, and I think we're going to get better at it. It's just kind of slow right now. It's work. If you wanted to quantify time, I mean, it took me and Ray about an hour and 15 minutes on Thursday to generate Friday's report. And that's two of us doing it. And it may just be that I'm just not very good at, maybe my system's not good, or I'm just not good at doing this type of stuff, obviously. But it's work. And, it's not so much the numbers, but it's like, okay, so you break that, you got 20 new cases. Well, then you got to go through and say, okay, where's the age ranges? And then are they at home, or are they in the hospital, or did they recover? And are they male? Are they, it's just.
So my feeling on that, Steve, is that some of that information is more important than others. Okay. And the issue around did they recover or things like that, isn't that stuff you're following up on anyhow? Or
well, yeah. Let's put it this way: in the general population that are not in any facilities, yes, that's quite easy to get. Now, the ones that are in the long-term care facilities, some of them have been shipped out of that place to the hospital, right? Well, when are they? Some of that data is tough to get and can be, but I am working on that. So,
yeah. So
Can we?
I mean,
I'm this twice. Sorry, go ahead.
Let me just say, I'm open to two modifications. One is looking at the data that's being collected and deciding what really has value. And secondly, the issue of whether it's once a week versus twice a week, I'm okay with if we reduce it to once a week, perhaps off cycle with the state numbers. And so you get state numbers once a week and our numbers once a week, and it gives you a quick snapshot on a twice a week basis.
Yeah, I mean, I think where I'm leaning to is that maybe having us generate a report. I'd like to work maybe with Steve, you and Ray for an hour or so and see if we can kind of streamline the process and find, better ways of doing it that might make it easier. If it turns out that we can't, then, we might be back here in a week saying that, we're going to, stop giving the report. But I think right now it might be worth making another attempt at a report.
And then why don't we do that then? I mean, but one of the things I would I think that's great, Nathan, if you can help Steve and Ray. But one of the things I would recommend is, at least for now, can we just cut it to once a week? Because I mean, to have him do this both on, he has to remember. Steve has to, all the members of the board of our board, he has to come to our Tuesday meetings weekly, and he has to do the reports, and he has to do everything else. So I'm just wondering, that instead of doing all of that, if we can just lessen it to once a week, and the report to me that matters is the one that gets released, that would be released on a Tuesday, so I can look at it on a Tuesday before our meeting.
I'm in favor of that, and again, I think this discussion has been productive, and Steve, obviously feel free to weigh in, But my suggestion would be we take this consensus to the Board of Selectmen for their feedback and proceed from there.
Yeah, that
So
sounds.
the consensus is that we do it once a week, and that Nathan
Yes.
will work on Steve on potentially streamlining it. Is that our consensus?
Yes.
Okay.
Steve, does that work with you?
Yeah, but the only thing I would say is, so the state report is going to come out on Wednesday, right? Every Wednesday. So I don't know if us having it Tuesday, Wednesday, is it better to space out our report to like Friday so you have a spacing, or I don't know.
Yeah, I think that could be something that you can work out as you and Nathan are working on. Just what actually is in the report and what work is involved in tabulating that stuff that's separate from the information you're gathering anyhow.
This is Lee. I didn't come in late, did I? Were we slated to start at 6:30? You guys started earlier?
Yes, the Board of Selectmen started at 6:30. The Board of Health right now is finishing up our meeting.
Okay, great. Thank you.
So I think that in terms of the report, that sounds like the way we'll proceed. Is there anything else that we want to discuss as part of the Board of Health?
So did you guys get a chance, did you guys get a chance to look at the Somerville rental protection document by any chance? I don't know who I sent it out to. Did I send it to you, Steve, or?
I know you sent it to me and Christy, but I don't.
I think it's forwarded, yes.
Okay.
Okay.
Do you want to introduce that?
Do we want to do it internally, or do we want to wait for the Board of Selectmen? What would you?
Syed, this is Ray. I think the governor just made a declaration today about having to do with rental properties and landlords and everything like that. So you may want to see what he did, because I think he did it for the entire state. So
Sorry.
Yeah, you may be just doing the same thing he already did, so you may want to look and see what he did today before you make a decision.
Well, I actually kind of did. So, Nathan, do we want to talk about this, or wait till the board?
I think we've got a couple minutes before the Board of Selectmen start. I think.
Well, it is 6:30, so.
Oh, okay. My clock's a little bit off, I guess. So I mean, we obviously having two meetings going on at the same time, it's a little tough. We can table this till the very end, or we can just table it till next week. So, do you have a strong feeling one way or the other?
Well, I would like to discuss it just towards the end, if you don't mind.
I'm planning on staying on. Are we planning on having the whole Board of Health stay on into a joint meeting, or are we just rolling over into a Board of Selectmen meeting?
No, we're just here for your meeting tonight. This is the joint Board of Health, Board of Selectmen. So we're on at 6:30, but it's really just the standard. We do not have anything else on our agenda tonight for the Board of Selectmen.
Okay, good. So then why don't we tackle, I think the two issues that we wanted to discuss was the report that Steve's been generating about COVID-19 cases. And then the other thing that Syed had brought up was the thing about renters and landlords.
Nathan, do you want me to I do have little updated numbers. It's not as comprehensive as what we usually get, but if people want to know where we're at.
Yeah.
So, again, this is, the last report I issued was on the 17th. So since then, we've had 15 new positive cases. So that's since Friday. We have had 7 additional deaths. So now we're up to 13 altogether. And we've had 8 residents that have recovered and 9 that have been removed from quarantine. So 139 total cases and 13 total deaths. I don't have that all breaking out by age and in sex and all that, but that's where we're at right now.
Good, thank you.
Nathan, I had mentioned about a moment of silence. Do you want to do it now with the Board of Selectmen with us?
I thought we did a moment of silence at the beginning of the meeting.
Okay.
May I ask a question?
Sure.
This is Lee. Thank you, Steve. It seems, although you just updated things, that we had almost a 60% increase in new cases, but a doubling of the people that were over 70 from 30 to 66. Am I reading that correctly?
Yeah, you are. That's from the governor's program where they went in and tested a bunch of the long-term care facilities. So half of our cases right now, give or take, are from long-term care facilities.
Okay.
And yep.
So I wonder, Alan, do you have advice or thoughts about how Westborough residents and the board might interpret that information?
So, I'm sorry. I want to make sure I'm not muted.
I should have said Dr. Ehrlich.
That's okay. Because there's Alan Edinburgh, I just want to be clear who you were speaking to. I think the notion that we're getting a big spike in cases in long-term care facilities has two components to it. One is any type of institutionalized setting increases the risk of a communicable disease being spread around. It doesn't matter what that communicable disease is, but when you have something like coronavirus, COVID-19, that is highly transmissible in any type of institutional setting, whether it be a long-term care facility, a prison, or anything else, it's going to spread very rapidly. The second thing is we really don't know how much it's already spread in the community because we have not had widespread testing just to see what's out there. And so because the people living in long-term care facilities tend to be at higher risk for complications, it makes sense to go in and test those people. But I know that there was some testing done, I believe in Chelsea, where 150 people who are completely asymptomatic tested positive recently. And so it's hard to know about the cases. I think I wouldn't worry so much about the uptick in the cases. The deaths are obviously very concerning, and the issue is obviously people who are at risk that we're identifying are elderly, often with comorbidities, and this is very serious when these people get infected. And unfortunately, aside from the usual things that we have talked about, social distancing, good hand washing, and use of personal protective equipment, there's not much else that can be done while we ride this out. I think it's important to remember that all of those things I just mentioned, the social distancing, the hand washing, the personal protective equipment, are not meant to prevent us all getting coronavirus. It has been meant to slow the spread. This is a very insidious disease because you have so many people with no symptoms who can spread it. And so it's hard to isolate just those people who are infected. And so because we're trying to slow the spread, that spread will still occur nonetheless. And when it happens in these vulnerable populations, then you can have, obviously tragic results. I hope that was a helpful explanation.
And to add to that, there's the study from Los Angeles County that showed at least 4.1% of adults have some, and again, this is preprint data, that they have antibodies to the virus in their blood. So that means that they were exposed at some point. So that potentially, if you extrapolate some of this data, currently at least 3% of the population the U.S. population is infected, 1 in 10 who will be hospitalized, and potentially 1 in 200 that are at risk of dying. And I know the Centers for Disease Control also looked at a outbreak in the homeless shelter in Boston where they tested like 397 residents, and they found that 146 of them, so almost about a quarter of them, sorry, not a quarter, I don't know, I'm not going to do the math, I'm not a math guy, 146 were positive out of 397 for COVID-19, but almost none of them had any symptoms. So I think this, as Dr. Ehrlich said, this disease is very much out there, and it is in the community.
Yeah. So,
and the question is, who are we missing? My concern is not who are we diagnosing. My concern is who is among the vulnerable population. There are people that have disabilities that cannot seek care, or that are in other communities with lack of health insurance that are not seeking care. So I think that reservoir is of concern.
Yeah, so this is one of the areas where the state is particularly interested in helping out and trying to help us identify cases. There's been a lot of talk about vulnerable populations. How do we reach out to them? People that might not speak English or might be homeless or might have other disabilities. And part of the state's new collaborative to do help with contact tracing. Their goal is to reach out and find everyone around every potential case to get them to figure out whether they have it. In order for us to drive us to the point where we can reopen and have people feel confident that we have this under control, is that we have to really know about every single case that's out there. And as Alan had said, there might still be some spread, and we have to acknowledge that. But if we know that it's, who they got it from and who it went to, and we're on top of it, making sure that those people that are around the ones that have been exposed remain in quarantine, it would allow us to then start releasing, the restrictions on other people in the population. So we're not there yet, but I think that's our goal, is to get to the point where contact tracing is good enough where we've identified the people that have it. And that would go for homeless shelters and other places that, right now we have rampant spread in some of the nursing homes, and getting the contact tracing there done is our first priority right now in terms of, where the National Guard's been pulled in to help out with testing. We're going to get to a point, though, where there's smaller numbers of new cases, and all of those have to be followed up in a way that we can then keep restrictions on those people that have been exposed. Had we done that from the beginning and we were on top of the testing and the treatment of and quarantining of people, we could have stopped the spread a little bit more. I think that what we've seen in both Westborough, in Massachusetts, United States, and all over the world is that if you don't have any restrictions in place, there's what they call an R factor, and it goes up by about 4, meaning that for every case, there's 4 new cases. As you start to put in social distancing and mitigation, the state today was saying that it looks like the R is about 1.25. So that means for every 1 case, there's 1.25 new cases. So that means that it's still increasing. You're still going to have more people infected than you had before. And so just the social distancing isn't enough. But the increase in contact tracing and making sure that those people that are exposed are the ones that really are staying home, it's a combination of testing and, restrictions on those people can bring it down below 1. And once we bring R down below 1, meaning that less than 1 person is, new person gets it for every case that exists, that's where we actually start to drive it out of the population. So I think we're taking the right route. I think that we're on the right path. But we still need to keep social distancing up until we can kind of get this in the right direction.
Nathan, this is Ian. Kind of bring it back to, I guess, more specifics on the Westborough. I know that to Lee's question, too, that we've had cases jump related to, as Steve said, with the care facilities. But I guess to you as a board and to Steve, are there other, I guess, they always say the term hotspots, but I guess are there other areas, or other things that concern you, or things that we should be looking to do as a town based on cases we're seeing that to what Dr. Walsh just talked about, things that we could be doing differently or may want to do differently based on cases we're now seeing?
So I can't say that there's any other type of hotspot, neighborhood hotspot, or anything like that. But obviously, we are getting the complaints every day about still people not social distancing, crowds, that sort of thing. Which it's disheartening to still get those. It's a hard thing sometimes to control. But obviously, that goes a long way in trying to turn this thing around. So again, it's just the same old plea that we've been doing now for weeks. People, please take it seriously. Social distancing, when you're lining up for a line, whether it be at the grocery store or at a restaurant, please, keep your spacing, masks if you can wear them, that sort of thing. I don't know if anybody else has anything else that they want to add.
So when I was looking at the numbers, and correct me if I'm wrong, Steve, before the nursing home spike with the elderly happened, there was kind of 2 spikes, one around the maybe 20-year-olds, and then another spike with kind of the people in their, that might be the parents of 20-year-olds. And so that might have been just lack of social distancing or people coming back from college that had caused those spikes. So that was some of the trends that I saw, and I'm trying to attribute it to something that might be affecting that age brackets. But I don't know if you have any thoughts on that.
Well, I can tell you that the 15 new cases we've had since the report on Friday, 13 of them have been, 2 have been in long-term care, but 13 of them are just are normal citizens, and quite honestly, they're not old, they're younger, under 50. Many of them actually, they're children under 20, who have gotten it from either the parents or vice versa. So, I would say one thing is that the amount of, and this is a generalization, obviously, but the amount of elderly that are getting it that are outside of the long-term care facilities has not been all that high. I've been getting more cases of people in their 40s, 30s, and now younger kids with it. So, take that for what it's worth, but that seems to be what I've seen.
And from my perspective on that, it may be an indicator that perhaps the social distancing isn't being implemented as stringently as we might like, but these are people who generally aren't getting hospitalized for this and, will quarantine for 2 weeks and generally, or so thereabouts, and generally get better. So are you hearing, Steve, that people in these younger age populations, say 50 and under, are being hospitalized for this? I mean, I know some people in that age range certainly are, but as a rule, they tend to do better. What are you hearing?
So right now, as far as hospitalizations, off the top of my head, we have one woman that's in the hospital right now that is not part of a long-term care facility. I talked to her last night. She's doing well. I'm sure she'll be discharged in the next couple of days. Before that, I knew of maybe 2 or 3 other residents who were hospitalized. They were all discharged and doing well. So, overall, all the deaths have been from long-term care facilities, okay, that we've had. We haven't had any residents outside of that demographic that have died. So
my question to the board is, do we want to, because of the concern because we're somewhere in the surge, we had talked about this before, but since I've gotten several emails about this, and I suspect Steve has also, do we want to discuss the mask situation, or do we want to explain do we want to explain to the should we require them to wear masks, 1, and if we're not, should we explain our rationale why so that people can understand, and 3, should we require people that are at in frontline occupations such as servers at restaurants, should we require them to wear masks?
Yeah, I mean, I think those are all good points to bring up. I'd say that right now our policy is that the governor has already issued an advisory that people should stay at home and that people should wear masks when they're out in public. I don't believe that anything that the governor has done has been a mandatory requirement that there be face coverings. We've adopted all of his recommendations, and I think up to this point we haven't gone further than what he has recommended. And so certainly if we want to talk about face masks, being worn at, in restaurants or places where food is being prepared, I don't think anyone is really serving food because I think it's all curbside pickup. But we can talk about that.
So Steve, do you know what are there any requirements for if you are working in a restaurant that if you're serving people in a restaurant, that you have to wear a mask or something? If you're working at the counter or something, because most restaurants are doing pickups, do you know what the process is? Yeah,
well, they're all doing pickup or curbside. So
right.
No, there's no, again, it's a recommendation. It's an advisory. I could kind of probably defer to Aaron and Ray a little bit. They've been in the places. Aaron's been in a lot more as far as the number that are and aren't doing that. Aaron, are you there?
I am. Yeah, I was just going to jump in. I'd say, honestly, it's probably the number one complaint we're getting right now is from residents calling saying, I was at so-and-so restaurant and they're not wearing masks. And it is just an advisory right now. We actually had a very kind resident who brought in a bunch of masks that she had made. So now when I'm going to these restaurants and I notice that they're not wearing them, I leave them some masks so that they do have them. I'd say it's about 50-50 whether the staff are wearing them or are not wearing them. Every time I go in, though, I do write on my report that that the Board of Health highly recommends that they are wearing these protective measures.
I'm just wondering for the
I'm curious to understand kind of what the if I own a business, I would be encouraging my staff to wear a mask so they could continue to stay in business to protect them and to protect the public. So I'm curious to hear kind of what, if there's resistance.
Absolutely. I wouldn't say it's resistance. I just think some people just don't know that they should be wearing masks. Again, every time I go, I'm explaining to the owners, the managers, the staff that, not only are they protecting the customers, it's usually not, if the kitchen staff are not seeing the customers, they need to protect themselves. Because if, some of these small restaurants, if one person gets sick, they're all going to be out. So it's just education, and that's kind of what I'm doing every time I go out, which is, basically, like I said, every complaint we're getting now is about masks. So I'm following up with them all.
So I want to just elaborate on what the masks do. The masks generally protect people who are not the wearer. They're not all that good at preventing you from getting infected, but they're useful to keep you from infecting somebody else. Because if you cough or when you talk, if you spray saliva or things like that, the mask will contain that. And so while I think what you're saying, Aaron, makes sense to encourage it for the health of the staff within the facility, my bigger concern is the people who are facing the public. And so, I would certainly entertain the idea of saying that whoever is delivering the food, whether it be at the curbside or if you're talking about a situation such as Dairy Queen where there's a counter person or something like that, whoever is interfacing with the public probably should be wearing a mask. And I don't know if you have thoughts about to me, the biggest problem with that is whether the facilities can have access to masks. And if they have access to masks, then I think that should be something we would want them to be doing.
Yeah, so I guess on the access to masks question, it comes down to a lot of what we define as a mask. If a mask is, an N95 rated, mask that's going to, reduce, particulate counts by 95%, it's very different than a surgical mask or just like a scarf or just something covering your nose and mouth. And I would say that everyone should be able to find something that can cover their nose and mouth. I think that that's a pretty low bar, and if we wanted to implement that, we could. I think that if we wanted to require that somebody have surgical masks or procedure masks or an N95 mask at an extreme, we'd have to have some way of making sure that restaurants could get those. And I think at this point in time, I don't think we have a way to ensure that they could get those higher quality masks. And therefore, I'm a little reluctant to require that that they would have to have them.
So the additional problem, I was at Stop and Shop, for example, on a complaint about this a few days ago, and the manager said that they recommend that all their staff wear them. They have signs up. They actually provide the N95 masks for all staff, and I saw them in a box there. But the union prevents them from requiring it.
So I think we should take the N95 mask issue off the table because nobody can wear those for an extended period of time easily. Right. It's just really not something that I think is feasible. Yeah. And again, if they're not fitted properly, the benefit of them over a surgical or / procedure mask is probably not that great. So, so the union issue is interesting. I don't know how that would play out if there was a Board of Health requirement. I don't know if anyone, whether Board of Selectmen or somebody.
It's no longer up to the management union discussion. It just becomes that's the rule in town, and if you want to operate in town, you've got to follow our rule, I think.
So to
I don't
summarize our
think I don't think too many of those restaurant workers are actually unionized either.
So to summarize our discussion, do we want to mandate that there should be some sort of facial covering if you're interacting with the customers for businesses in town? I mean, not just restaurants, but others. Do we want to do? I mean, I guess do we want to do that, or do we want to think about it? What would you guys like to do?
Well, yeah, let's first decide, is there a distinction between, let's say, just the people that are delivering food that have contact with people, and then like everyone like at a grocery store that might be near a customer as well? You know, are those essentially the same group of people, or do we want different rules for those two different groups?
I think keep it simple, stupid.
As in just have a same rule that applies to everyone interacting with the public?
Yeah,
Yes.
I think just keep it simple. It's easier, and the message can. And the other thing that we can then use is use the town's mechanism to get it. Town's mechanisms to get it out there that all businesses, whether it's whatever is open, can enforce it. I think it's.
Yeah, I mean, I think there's no difference whether you're going to Stop and Shop or you're going to Lowe's, or Walmart for that matter. You're in a crowded place with a lot of people, and that's precisely the place where masks have the greatest benefit. And I know there are limits on the number of people who can enter the building. I know that the governors put that in place, but nonetheless, compared to most other scenarios, I find myself that's where I'm encountering the most other members of the public.
So just, Dr. Ehrlich, just to your earlier point, this is Shelby. I think what's being discussed is any sort of public facing. So let's use a small restaurant. They've got kitchen staff. They're never actually seeing someone come in. I think the board is saying they would be comfortable in those individuals behind the scenes, so to speak, would not have to. It would be up to them. It's recommended, but they don't have to wear a mask. But anyone kind of coming forward to engage outside of that small group would then need to wear a mask. Is that what we're saying?
That's what I would be in favor of. I think, again, you got a warehouse worker who's just bringing stock in and doesn't interact with the public at all. Fine. Again, we encourage it, but that's not where the public health concern would be. Obviously, the public health concern is you have an individual who's encountering lots of other members of the public, and if that person is asymptomatic and is shedding, you suddenly have widespread, disease.
Mm-hmm. Okay.
So do we want to make a motion about that? Or
Yeah,
what do
I
we
think
want to do?
we probably as a board should
If I
agree
may
on-
ask one question?
What's that?
So, I mean, the recommendation, as I understand with masks, is if you're regularly, or if you're in a situation where you're going to be in close contact with other individuals. And that, so I think about, the kitchen staff in a restaurant who are working in close proximity for the full day. Are we concerned that, they're more than 15 minutes within 6 feet of each other and spreading? I don't know if we have, large facilities. I mean, we've seen in other areas of the country, meatpacking plants shut down because workers with no, employment exposure to the general public infected each other. Or at this point, are we far enough along where we think that, if a team's been working in a restaurant for the last 4 weeks and they haven't infected each other, they're not going to?
Well, and Alan, I would add that there might be some businesses who are regularly taking temperature multiple times a day. They may have already their own precautions in place, regardless of the type of industry they're in. And I'm not sure how the Board of Health practically can, police that. I just.
No, understood.
You know what I mean? I mean, so I agree with you. I totally agree with what you're saying. That to me, it's just as important whether if my line worker gets infected as to the public, right? It doesn't matter. It's still a life being infected, and then it has a cascading effect. But at some point, I think, I would like us to be able to sort of maybe draw the line, which is where I sort of thought the conversation was going.
Yeah, so I do think that there is a big difference, or not a big, but there is a difference between those people that are at the interface of the public and a private corporation, and those that are all within a private corporation. Obviously, the private corporation is going to have some interests of their own that they're looking out for. They have a bottom line, but they also have a, can they continue to operate in the future? Are they going to lose all their workers? Do they have a work environment that people like to work at? All of those things the private corporation is already thinking about, and hopefully that will be enough to spur them to want all their people to be wearing masks. As far as the interaction with the public, if you go into, a store, you might not know whether they have masks or not. You might not know the status until you're actually already there. Like if you order pickup,
Right.
but you show up to pick it up and they come out to your car without a mask, you don't have a lot of options at that point. So from that point of view, I view them as different, and it might be that we both want to make two rules, one for each group, or we may want to just make a rule for one. And I'm not exactly how our rulemaking process goes, whether it's a recommendation from the board and then the selectmen issue the order, or whether we issue a joint order, or whether
I think the authority goes to the Board of Health. I don't think it's the Board of Selectmen here, but I'll look to. I think it's really you have the power in a situation like this for orders.
Yeah.
But
I agree. I don't think we need anyone else if we deem that a public health measure.
So I support where we're looking at delineating. I was just looking for some clarification. So thank you.
So let's take the unless there's more discussion, I'd like to start talking about the public-facing employees first.
Yeah. So my questions would be, first of all, the actual implementation of such a rule, and I say that on the basis of the fact that if we're saying this is for all public-facing employees, not all of those are going to be facilities that are regularly inspected by the Board of Health. So do we even know what that list consists of, for instance? Maybe the vast majority are, but that would be my first question for, I guess, Erin and Steve in particular, as well as Ray.
Well, I guess, if we made the regulation, those facilities we don't go into, we just have to rely on complaints to a point, I guess. How else would we really know about them?
Okay.
But it gives Ray and Aaron and Steve the power, right? If they get a complaint, then they can say that this is, if they get a complaint from, about X store, they can then say that, look, this is the regulation per the Board of Health. And more importantly, we have an, involved, educated population that can, help spread the word.
The other question I have is, and we obviously don't need to answer this tonight, but at some level, we need to think about how such an order gets undone in the future. At some point, we may reach a situation where many people continue to voluntarily wear masks, but perhaps the rationale is not as strong as it is at this moment while we're still in the middle of the surge. And so I just want to have if we go down this route, which is somewhat unprecedented for us as a board, to have a clear idea of what are the parameters that might lead us to say, okay, this is no longer necessary.
But we just put it in the wording of the motion that it'll be only for the duration of the public health crisis.
I might actually go a step further and actually have a specific end date. And we can always end it earlier if we want to, but that forces us to discuss it and say, do we want it to keep going? So for instance, if we gave it a 2-week, period of time that it was enforced, then in 2 weeks we meet again and, we'd have to say, oh yeah, remember we've got to, extend this mask order. And that way, if it slips off our radar, it's ended. And we don't,
Okay.
I'm comfortable with that.
Because I imagine something like this, we might actually end before the state of emergency is over if things are looking very promising, especially if Westborough is very different than the entire state. We might recover faster, we might recover later, but giving us that flexibility, I think, is nice.
can I make a suggestion? You mentioned 2 weeks. I guess my concern is, again, thinking about the staff and the work that they'll need to do. It seems like it would be easier to do, say, 4 weeks, and then if you have to reduce it to 2 weeks, reduce it versus 2 weeks, and then having them have to go out to the businesses again with communications and.
Yeah, 4 weeks could be much better choice. I was more just saying that an end date would make it, I think, a little bit easier than saying the end of the state of emergency or just no end date.
Yeah. Okay. Thanks.
Do you think 4 weeks is appropriate? Does anyone else want to weigh into timelines?
I think 4 weeks is a good number. I think, according to the governor, the surge was expected to be approximately starting around April 10th and going for 10 to 14 days. So, we're getting towards the end of that. But even after the so-called surge is over, I think, we will not be out of the woods right away. And so I think 4 weeks is a reasonable time frame. I think it's likely that the governor is going to extend many of his restrictions on public gatherings and whatnot once May 4th rolls around, or whatever date he had set as the latest. And so I feel like it's consistent with, if you look at other places, how long it takes for things to start to get back to a less risky situation.
Yeah. So as this motion shapes up, we're looking at having a requirement that employees that are working in Westborough that interact or come in contact with the public are required to wear face masks for a duration.
Facial covering, not
facial covering. Yes, I like that better.
And also, your definition of common contact is that 3 feet from a customer, consulting with them on wares or at the register. Want to have a little bit of a definition for contact?
I would think that any of those. I mean, I think even if you have somebody that is stocking the shelves at the same time that customers are walking in that aisle, that would count as customer contact.
Yeah. So I think, to be towards Lee's point, we should have a definition of customer facing or customer interacting, and I would stipulate the following as individuals who are interacting with customers: people who are cashiers, people stocking while customers are in the store, people providing customer service, and anyone who is delivering goods from the store to an individual's car or home. So I see a question about UPS and FedEx.
It seems like they should follow the same rules unless we're making someone need contact with the customer. If they're just leaving on the doorstep.
Yeah, that's what they're doing now. Everything I've gotten is not even a knock or whatever. It's just going on the doorstep.
Yeah, I agree.
UPS, FedEx have all gone to signatureless delivery, so there's no customer contact.
Right.
Yeah, so I think that if someone wanted to do customerless contact, that should be exempt from this requirement. But if you have to come in contact with the customer, then it should fall in there. So we've got to figure out a little bit.
So let's try and define that. So I went to one restaurant who had started a takeout service at one point, and they had a door that you open to get into the restaurant. There's a little foyer, and then there's another door to actually enter the main part of the restaurant. And there was a table in that foyer, so they would just put your takeout food on the table. You just open the door, your name's on it, and you grab it. Is that contactless? So if you're not interacting with anyone inside the restaurant, I assume then they don't need to be wearing masks. Would that be fair?
I would think so. I would think, though, that the person that brings it to the table and the fact that there could be a customer in that foyer, they could come in contact. So the person who brings it to the table should probably have some sort of face covering.
Yep. Okay.
But the whole rest of the restaurant, I don't think would be required to. They'd be recommended, but not required.
All right.
Did we explain that enough, Paula, for you to actually wordsmith that? Is Paula still on?
Yeah, I think I got it. I not a problem. I understand.
Good. Do we have a motion then on that? Or do we want to still add more features to it?
I don't want to add more features, but I do want to get a sense of the rollout and how people. So, and also we need a date that it's effective as of. those types of things. So, Steve, you want to weigh in on this at all?
Yeah. So it's going to take time to get through all the different, all the different modalities, but you could make it effective whenever, and we can get it up to the restaurants pretty quick now. As far as all the other little places, it's just going to be an education thing. We could post it on our website. Obviously, we could put it on the town's website and shoot out an email blast. We're going to miss people. It's going to be an education thing that's going to happen at some point.
I think you could also ask the Rotary Club and the Corridor 9 Chamber to forward it to their members who have businesses within Westborough.
I imagine that customers themselves are going to be our biggest proponent. They're going to call up those restaurants and be like, didn't you hear it's a Board of Health requirement? You got to do it. Go check out their website. And they'll go look at the website and be like, oh, I guess it is a rule. So I have a feeling that there's going to be some education that goes on that way.
I mean, we have a fairly substantial email list, but not every place. So we can get that out quick.
To give people, in case there is a need to either get a mask or fashion one, my proposal would be that we have this go into effect on Friday. Because obviously the weekend may be a busy time for people being out and about, and that would be, if we can get some compliance before then. I mean, obviously anyone can start at any time, but if it goes into effect for this weekend, I think that'll have the biggest effect as opposed to waiting until next week.
Do you think that's reasonable, Steve, if we did a Friday start date?
Sure. I don't know. Did you actually make a motion, or are you going to do that?
We're putting it together.
We'll make a motion.
If you do it, then you can code red too.
Christy, I couldn't hear what you said.
If you do it on Friday, we can also put it in the code red on Sunday.
Oh, I think it's reasonable. We can get it all together by then.
Now, is the number of complaints that are going to come in from people, let's say, on Saturday and Sunday, be a little awkward because, it's the weekend, as opposed to if it went on a Monday, that you guys might be more responsive to complaints on Monday?
Yeah. Well, I mean, we'll get them. I'll get them. If people leave a message, I get it here in my, my house. People just have to understand that we're not going to go out till Monday to, check. But
but I think Dr. Ehrlich was spot on though with Friday. I mean, that's our biggest. I mean, if you look, what I've seen is Fridays and Saturdays are the biggest time that people are using, the services that we're talking about here. So I think wait until Monday, you've kind of given up another week of this for the most part. So I think doing it on Friday makes sense to me.
Yep. So is that the 24th? Is that Friday?
I believe so.
Yes.
So I think we're ready to have a motion from somebody.
You want me to read what I have?
That'd be great.
I don't know how good it is, but I can go back and listen. So the motion would be to enforce a requirement that employees that interact or come in customer contact wear facial covering, and that would include individuals who are interacting, such as cashiers, employees stocking shelves where customers are present, providing customer service, delivering goods from stores to a car or home, effective Friday, April 20, what do we say? April 24th.
Yeah, I think we need an exemption, though, for contactless.
Oh, yeah, contact, yeah. And the customerless contacts are exempt. Customer contact, what do you want me to say, like businesses or?
Businesses making deliveries where they do not come in contact, or businesses providing services or making deliveries that do not come in contact with the public are exempt from this regulation.
Yeah, that sounds pretty reasonable to me. Syed or Alan, you ready to?
Yeah, so the one thing that we don't have in here, and I actually am happy or content that it's the way it is, obviously we don't have any kind of enforcement mechanism. I think we should just do this as a order from the Board of Health, and if we are having problems where there's not compliance and we're having public health issues related to that, then I'd revisit it. But for now, I think it's going to be trouble to try and put in fines or something like that. I don't want to go down that route.
Yeah, I think that for the restaurants, it's a little bit easier because we can always leverage the fact that we can shut them down until they get a face mask on. But some of the other places like a Lowe's or a Stop and Shop, or I guess Lowe's or other places that don't really have a food service portion of their business would be harder for us to enforce. But we'll have to revisit that if we think there's non-compliance.
Yeah, and so the one other thing that the order needs is an end date, that this is for a duration of 4 weeks, which will be 28 business days. Or 28, calendar days, rather.
Yes. Yep. Good. So as amended, I think that's sounding pretty good. Syed, you or Ellen want to make a motion?
I'll make the motion as Paula has read it, with the end date of 28 business days from the start of from April the 24th.
20 calendar days? Or
Calendar days.
Calendar.
28 calendar days.
Good. I second that motion. We'll do it by roll call. Dr. Ehrlich?
Yes.
Dr. Hashmi?
Yes.
Dr. Walsh? Yes. So then there's a question of, other businesses and stuff like that internally. I'm at this point not really in favor of making a motion there, but if someone else wants to, in terms of all the other employees in town, whether they need to wear some sort of face covering while they're at work that might not interact with the public.
I would not be in favor of that at this time.
Okay, it sounds like there's a majority of the board that's not in favor of that at this time. And so obviously doesn't mean that we won't be in favor of it at a different time, but I think right now we're good. Was there anything else that we wanted to discuss?
Yeah, so
yes.
Don't forget we have a couple of items. One is the business of the report.
Yep.
Yeah, if we could just nail down the day that you want, well, whatever. I agree.
So I think we need to formally discuss with the Board of Selectmen the opinion of the Board of Health from our meeting prior to this.
Yeah, so to set the scene, the Board of Selectmen had asked for a report from the Board of Health. The Board of Health had been providing these reports. The state has taken over some of this reporting mechanism. And so the Board of Health had a meeting earlier, or this meeting where earlier we had discussed the report and whether we thought we should continue to be making the reports for our benefit or whether we didn't. I think we decided that having a report once a week is actually still good for us as long as we can find a way to make it so that the burden on Steve is not quite as high as it is right now. So by going to once a week and mostly tracking the, one of the benefits of our report is that we include presumptive cases. And I think that we kind of also introduced kind of the new cases since the last report. And those features we thought were missing from the state report. So we kind of wanted to hear from the Board of Selectmen about what you guys think in terms of the reports and, whether this is in line with what we were thinking.
Yeah, this is Ian. I'll just jump in. I think it sounds like you nailed everything. My first comment was I know that with the state doing it and the amount of work that Steve and staff had, there was a concern there about, him doing the report versus doing the more important things like contact tracing and some of that stuff. And I know he's getting help with that, but it sounds like your discussion earlier already talked about ensuring that, it wasn't trying to lessen the burden on him. I think once a week makes sense instead of the twice a week. I do think I've heard comments that people really appreciated that. So if it can be done and it's not too much of a burden, I think once a week, a document on our side would be helpful to the public.
Again,
Ian,
go ahead, please. Go ahead.
Leah, I agree with Ian once a week. I think it would be really helpful, though, along with that report, if there's some way for Dr. Ehrlich or one of you to give a little bit of interpretation to the report, as you did when I spoke to you earlier this evening. So in a way that sort of reassures the public. but also is realistic. This isn't a time for parents with children to let their guard down, even though the majority of the increase is in the elderly or people in nursing homes, and how empathetic we are to the families that are going through that, but just a little bit of interpretation and guidance. Like, what does this really mean? What's the take home for you kind of statement?
I'd be happy to work with Steve on that if the other board members are fine with that, to provide a little commentary with the report once a week.
I think you'd be the most appropriate person to do that, so I'm in favor of that as well. Do you have a problem, Syed?
I'm sorry, I was on mute. This is perfect. Thank you.
Yes, this is Shelby. I'm fully supportive of a weekly report. I think, and I love the idea of what was just discussed. So thank you for continuing to support both.
Good. I think that for the Board of Selectmen, one of the areas that is hardest or it takes the most time right now, unless we find an easier way to do it, is doing a lot of the breakdown by age and by sex and all of those different categories. I think that's the little bit more tedious part of making the report. And so if we can find a way of making it easier, we'll continue to provide that. But if it turns out that that's hard to do in a way that's not so tedious, then that might be one of the first parts of the report that we trim down. But we'll make an effort to include that.
Can I ask just a general question about the reporting mechanism between, say, long-term care facilities and to the Board of Health? So I'm just curious, what is the, knowing that, I guess, what is any business's requirement, particularly residential settings, we'll just say, to report known cases to the Board of Health, and what's the frequency of that? So,
okay, yeah, frequency over the last 2 weeks has been almost by the minute. I get emails every time there's a positive case in town. I get an email, and so the 60 plus cases we've had over the last 2 weeks, my email never stops. So anyone who tests positive. And now the turnaround for the test is like 24 hours. It's even less than that. And so if they test positive, it goes into the system. I get an email. I know about it right away. The facility really has nothing to do with it. I get it no matter what. They have no say in the matter.
Okay.
So it's constant. Yeah.
That email is coming from the Maven system. The facility isn't having to initiate that contact. Okay, thank you. That's
the one area where it might come into play is like presumptive cases. If instead of actually, the patient's being tested and having an actual test done, they just say, oh, you have all the symptoms. We believe you have COVID-19. We're going to try to keep you in an isolated wing, but we're not going to test you. Then those cases might not get entered into the electronic system, and then we might not get notified about them. We encourage those doctors and places that are making that decision that someone has COVID-19 to, if they're not running a test, to at least notify the Board of Health or to enter it into the Maven system as a communicable disease so that then shows up on our radar so that we can do contact tracing. But if they don't run a lab-based test, then there is the chance that we don't get notified about it.
I may ask a question. If someone goes to the hospital and they're tested and it's negative, which happened to my son on Monday, do you hear about that?
Only if I go searching for it. So I don't get a notification like I do the positive ones. Mm-hmm. So I've almost made this mistake a bunch of times. I'll go in there and let's say, I'm just taking a name. Let's say I search for someone named Steve that I know is positive. Well, if I don't pay attention, a bunch will come up saying they've been tested for coronavirus. But if I don't go in and actually pay attention to what the test results are, I could be calling people who are, I almost did this a bunch of times. So no, they the system, but I don't get notifications. So unless you asked me to look up your son, I'm not going searching for that.
Right. No, I just wondered if it got reported to you. He had 2 tests, I guess they do, to make sure, and it was negative. So I didn't know. I guess you don't need to know about that. If that person is negative, why would you have to know?
No, they're in the system, but it's not pointed out to me, and I don't go hunting for it.
And the other aspect of a negative test is even if you're negative today, it doesn't mean that you're not negative tomorrow, or that you're still going to be negative tomorrow. You can pick up the disease even after a negative test. So a negative test is only accurate for the time at which you took the test.
Taken. Right.
Yeah.
Well, he was advised to quarantine for 14 days anyway.
Yeah, it's not, Nathan. It's not even valid that long. Okay.
Yeah.
Because you may have been infected, but you have not started shedding yet. You're still in the incubation period. So you could, if you went into isolation after a negative test, you can still turn positive.
Well put.
What is the incubation period, Dr. Ehrlich, or anyone?
Well, it's up to 2 weeks is what they say. There may be some outliers that's slightly longer. The typical incubation period is about 5 days. So most people will turn positive 5 days after an exposure. By turning positive, either you're shedding virus or you're having symptoms. But some people can take longer. And that's why the 2 week isolation is what's advised.
Good. So I think that we might, let's see. Sorry, did you say there was something else we wanted to discuss?
Yeah, there were. Go ahead.
One thing quick. We don't need a motion on changing the frequency of the report, do we? I don't know how the report was created, whether it was a motion or not.
It looks like Ian is shaking his head no. So.
And
I mean, we can put one in, but I think it sounded to me like we're universally in agreement. So I think just
fine. Okay, great.
And so, can I just circle around? Is there value to putting out the state report on Wednesday, and then what we want to do the town report on Friday? Is that kind of how we wanted to think about doing this, or?
I think that's probably the easiest way of doing it and least burdensome to you.
Okay. I mean, linking the
whatever works best for you, Steve. My thing is whatever is easiest and best for you is what I'd vote for.
Well, I guess my question is, do you want us to post the state report online for people to see? It's just a matter of putting the link. It comes out every Wednesday. It'll be out tomorrow at 4.
I can post the state report. I've been posting all of the reports that you've been sending me, so I can post it.
I think it's good.
And we did get an email from a resident today saying that the state report, I think they posted in Word format and he couldn't open it. So maybe if we could, convert that to PDF before we put it on.
Yeah, I went and looked at it so I could see what format it's in. So I'll put it in PDF and then I can link it and then also put it on, excuse me, I can screenshot it and put it on Facebook.
Okay, thank you.
Yep.
So, Nathan?
Go ahead.
So is this the end of the report discussion?
I believe it is.
Okay, so I just had a couple of minor points, and I'm glad Christy is on board because I thought I could. She probably knows this, but I just thought I'd share. There's for first responders and healthcare workers. The Attorney General has set up a one-stop shop website called frontlinema.org, so we can probably share that information. And and one of the concerns that I've been reading in my own forums and talking to the people that I know is that apparently people with strokes, heart attacks, and appendicitis aren't showing up in the hospital. And so the question is, where did those heart attacks go? Where is those appendicitis? They just didn't magically disappear. So I know that I don't want to burden people with extra work, but I'm wondering, I know our police chief keeps track of his EMS volume, so I'm just wondering, is it possible to get from Christy, is it possible to get a sense of where our EMS volumes are? Are they the same as they were last year, less, more? And I don't know if he breaks the calls that he gets by diagnoses, but if it's possible, I'm just kind of scared, where did the heart attacks go? Did they just, they kind of disappeared?
So if I can jump in, Christy, for a second, I think this is a really important question. I would encourage trying to gather some of that data if it can be readily obtained. But Syed, I would tell you that they didn't all disappear, that what happens is so many people are infected with COVID-19. If you have COVID-19 and you have a heart attack, your presumptive diagnosis of the COVID-19
right.
triggered that, whether it's true or not. That's how things are being classified. And then the other thing is, so many people are at home, they're not doing many of the activities that often would precipitate heart attacks, whether it be exertion in some fashion or other things. And so there's a number of reasons why deaths from other causes or illness, morbidity from other causes are down. I mean, all the sheltering in place is limiting, our exposure to other infectious diseases that might trigger heart attacks and things like that. So.
I also want to say that any sort of report about a breakdown in terms of what people were suffering with the ambulance calls, we have to be careful to balance privacy of information.
Yeah, no, and I don't want to.
There are only a couple of ambulance calls, and the addresses are listed for the ambulance call. You wouldn't want to layer on that saying that there were 2 heart attacks, because then you'd actually be giving very private medical data out about people.
No, I just wanted like a rough breakdown. Have our EMS volumes gone up, down, same, and has there been a change? Because I just, like, for instance, and Dr. Ehrlich is right about potentially about the heart attacks, but like, where did the appendicitis go? Like, what happened to them? Because that is the most common surgical emergency. Where did it just can't have magically like vanished. So if it's possible, if it's not a lot of work, that was one of the requests that I had. The other, and along those lines, one of the other concerns that I had is about we have a hotline for, I think there's this referral service for anxiety and stress and all of that. And I was just wondering if we can tap that just to see if just to get a snapshot of where do we stand. Are people using that service, not using that service? Has the volume of that increased, stayed the same, or declined, which would be very concerning for me. So if Christy, if that's not a lot of work, I'd just like to get a sense of where the community stands with regards to its, I guess, stress. And that would be a rough way to gauge it, for want of a better word.
Yeah, I can ask Kara what kind of reports they provide, because I don't think we've requested a report before. Chief Purcell.
Like a number of calls, just like, hey, have you gotten like 100,000 calls or no calls? I just would like to know like where we stand.
Okay.
And then along those lines, one of the other concerns that I have is, again, this whole sheltering in place puts a lot of stressors on the family. And so I'm wondering if, when we're asking Kara for those numbers, I wonder, does she keep on? And again, this is personal, private information. I don't want it, but I just want to know: is there a list of vulnerable populations that we check in on? I know that for like seniors, the senior center calls vulnerable seniors. Do we call vulnerable young people to see if they're okay?
I don't think we call vulnerable young people, Sad, but she does have a client list of people that she knows, from family and community, the Family Health Service. So she knows the people that are in difficulty, and they know to call her. I think she's done a lot of outreach to them. And then Karen Polito and the governor have done a great outreach for women at risk for abusive relationships and abuse at home. And there's a couple hotlines for that. So I think there's been a lot of publicity around that.
Well, I would also say that the school department reaches out to families that they're aware of.
So that's all I just want to make sure that there's some, like if they're vulnerable children, I just don't want them, I guess, falling off the radar, especially now that school is not going to be opening. I just, at least in the...
Yeah, I believe the counselors are still, we can confirm the number, but I believe the counselors are still doing their work.
Syed, although it's not this is Shelby, although it's not a one-to-one relationship, certainly some of the vulnerable children are also those that would be or could be receiving breakfast and lunch to the system. So there's a daily checkpoint.
Okay.
There.
Yeah, that's right, Shelby.
And
right.
I'd also say that through the task force, we've learned that there are multiple points of outreach through multiple groups to different seniors across the community, through the senior center, through Westborough Cares, through St. Luke's, through the Kirkside Foundation. So I think I can't say with certainty everyone is covered, but I do think that there's extensive outreach happening on a regular basis, and there's coordination. And then if there are individuals that are, sort of new to that fold and need outreach, I'm very confident based on those conversations that there's a very quick connection from town department or from one of these groups to that individual.
Okay, great.
Thank
So
you.
yeah, if Christy, if it's not, so then maybe just the fire and the stress data, if it's not a lot of work, I just would like to get a sense of where we stand as from a health, kind of a crude health of our community. That's not a lot of work.
Oh, I can do that.
Thank you.
Okay. And then, do you want to discuss the foreclosure stuff, Nathan?
Let's see, it's 7:30. I mean, is there anything new to report, Steve? I think that a lot of the courts are closed, so there might not be too much to discuss.
What about the legislation that was signed yesterday, basically stopping all evictions?
Yeah.
So one of the concerns I had about that, and thank you, I think, and again, thank you for Sela. She sent me some of I think Representative Dykma had sent the legislation. My concern is if you look at that and that legislation covers most of it, but it's all about the rental units, and the legislation that Somerville released, and I just want to just read it for you. The additional thing that the Somerville legislation does, it says, is that no landlord/owner shall access a tenant's dwelling space for purposes of general inspection, displaying units to potential future tenants, and other non-critical activity. And the landlord may only access a tenant's dwelling space to make repairs requested by the tenant. A tenant may refuse access for entry. And I think this critical thing is not present in the legislation that the governor signed. So I was just bringing that up to say maybe we could use that additional language. And again, if you guys want to think about it and discuss it next week, I leave it up to you.
Again, this is one this is one that the legislators really stepped up, and I think we had a discussion on this, and they pushed it through. I would think if there's a groundswell of support, I don't think it's something we do on a town level. I think looking to the legislation, see if the thoughts from a statewide level, I think it carries a lot more weight.
I'm also trying to find the public health perspective in this. Is this that you're afraid, Syed, that the landlord, by bringing someone into the space, is going to be bringing like COVID-19 into the space, or is it
that couple of things? Yeah, one, my biggest thing for this is making sure people are not thrown out on the streets, and I think the statewide legislation does that. But my other concern, my other concern is the showing of the apartments, and potentially landlords being, I guess, in a way, threatening to residents, especially people that may be more vulnerable now if they've lost their jobs. And again, you're right. It may not be a specific. You're right. It may not be a specific Board of Health concern. I agree, but it did concern me. Sorry.
So Syed, some of those protections I think already exist. So the tenant has possession of the unit, okay, and the landlord can only go in with the tenant's permission. Okay, so if the tenant's if a landlord's trying to force themselves into a unit, it's a police issue. They should be calling the police. The police should be showing up, and so some of that I think is already covered. That's how we've always been taught.
Okay. All right. Well, I think that's reasonable then.
Excellent. I'd like to entertain a motion that we adjourn, unless there's something else that somebody needs to talk about.
I just want to have an understanding of what we're doing next week. I don't know what the Board of Selectmen are doing, so just so it's clear, is it a joint meeting? What are we starting at 6:30? What are we doing?
Yeah, so we have our regular Board of Selectmen meeting next week. So I think I'll look at Christy here too, but I think the plan would be, as we did last week, would be 6:30. We'll start off with a joint meeting of the Board of Health and Board of Selectmen, and then once we finish that session, we'll continue on with the Board of Selectmen's meeting.
Sounds good. In that case,
sorry.
Sorry.
Go ahead.
Say
one other thing. Sorry. And again, I don't want to burden Steve, but one of the other things that has come out, I meant to mention this earlier, that, African Americans are constituting a third of all coronavirus cases, and they're also contributing to a significant morbidity and mortality. I was wondering, I don't know, I don't think the state is breaking it down by race. Am I right, Steve?
They are. The state is.
Right?
The state is
not.
They just started doing that.
Yeah, and it's non-Hispanic whites are still the highest percentage.
Okay, so are we getting that data for Westborough, Steve? Do you know?
It really depends. If some people don't answer the question,
okay, right, that's what I thought.
We can't force people to answer questions on certain things. So
yeah, I think you're right, Steve. It looks like on the state, I was just as we do, I've been looking at the state site, and over 50% of them are not disclosing.
Correct.
Okay.
Can I ask the Board of Health one follow-up question to a meeting a couple of weeks ago? I don't know if it was 2 or last week. When a decision is made to shut down a construction site, such as the one that is on the corner of the Burger King one, what is the policy to reopen that site, given the state of the state?
I don't think it's closed, Shelby.
Yeah, no, we did. Ray, are you on?
Yeah, I'm on. So they were closed down until they came into compliance. That's how Fred put it. They came into compliance. Right now, they were sealing up the building. There were some gaps in the roof. There were some gaps in the windows. So they have to secure the building to be safe under the building code. So that's what they were doing. I don't know what they're doing now, but everything goes through Fred right now.
Thank you for the clarification.
Okay, once again, I'm going to move we adjourn.
Okay. With our next meeting scheduled for next Tuesday.
Yes.
Yep, I second that motion. Dr. Hashmi?
Yes.
Dr. Ehrlich?
Yes.
Dr. Walsh? Yes. Thank you for participating.
If I could?
Yeah, please.
Motion to adjourn on the Board of Selectmen side.
I second that.
Okay. Selectman Emery?
Yes, and thank you, Board of Health, for all your time. I really appreciate it.
We appreciate yours.
Selectman Marshall?
Yes.
You just want to stay on.
No, I love all of you. Yes, thank you for your time.
Selectman Edinburgh?
Edinburgh, yes.
Selectman Hashmi?
Hashmi, yes.
And Selectman Johnson, yes. So thank you. We're adjourned.
All right, good night.
Great.
Have a good night.